Now we'll talk about the 13th emergency in first aid, which is fainting. Fainting is a sudden partial or complete loss of consciousness due to a momentary decrease in the blood supply to the brain. There's not enough blood going to the brain, and so you become unconscious. It can be sudden, partial, or complete stop, okay, of consciousness. What can cause fainting? Now, fainting is also known as syncope. So, the causes of fainting includes when you have been standing for a very long period of time. There's going to be poor return of blood to the heart via the veins, that is known as venous return. So that can actually cause fainting. Also, standing or working in a hot place for a long time can cause exhaustion, and that can lead to fainting. Running for a long time is going to cause oxygen to be depleted. Okay, and when oxygen has been depleted, it means it's not enough going to the brain, and that can cause fainting. What are some of the signs and symptoms? So we're going to see extreme paleness on the victim, sweating, coldness of the skin, dizziness, numb or tingling of the hands and feet. So hope we know what it means to be numb. Okay, we call it fungalashi in Bemba. So if the skin is numb or there's tingling, imagine, think of it when you hit your elbow on, let's say, on a desk or something. That feeling that you feel, that is tingling. There's also nausea and also some blurred vision. Someone can collapse, okay, and there's also a temporal loss of consciousness. The pulse can be normal, but the blood pressure can actually be decreased. So these are some of the signs. So how do you now treat someone that has fainted? So usually this patient is going to recover after falling or after lying down. Normally they're supposed to recover by themselves just after they fall, because of that period when there was not enough oxygen delivery to the tissue. So if someone is in a pre-unconscious state before they become unconscious, the victim complains of feeling faint. Okay, if the victim complains of feeling faint, get him to sit with his head between his knees, as like that. So this is before they faint. But if someone is already in an unconscious state, place the victim in a semi-prone position. So that is the semi-prone position we can see there. Maintain an open airway. Very important. Always make sure that the ABC is okay. Airway is open, there is breathing happening, there is circulation happening. You are going to loosen any tight clothing from the neck, chest, and also from the waist. Wipe the face with a cool wet cloth or place the wet cloth on the forehead in case a person has fainted. Also check that the victim was not injured when the fall happened. Unless recovery is prompted, you need to make sure that you seek medical assistance. Okay, so that is it on fainting. In the next class, we'll talk about cardiac arrest. Thank you so much for watching.